With airflow through the upper airway again, sensation, positive pressures, and a more normal physiologic system are restored. Therefore, patients realize significant clinical benefits. Airflow through the vocal folds gives patients louder, clearer, and uninterrupted voice and increased length of speech. Being able to communicate with others reduces anxiety and frustration and increases socialization and well-being. Smell and taste are also improved, and many patients experience an increase in appetite, oral intake, and nutritional status. The Passy Muir valve has been clinically proven to improve swallow. With tracheal cuff deflation, the larynx and epiglottis have greater range of movement for airway protection. A closed respiratory system restores positive subglottic pressure when the vocal folds close. And improved sensation throughout the upper airway increases the safety of the swallow and may reduce aspiration for many tracheostomized patients. In addition, airflow through the oral and nasal cavities contributes to the evaporation of secretions. Patients produce a stronger cough, resulting in improved secretion management and less frequent suctioning. With the Passy Muir valve, physiologic PEEP is also re-established. Alveoli open, facilitating improved gas exchange and oxygenation. In summary, the Passy Muir valve provides numerous clinical benefits, which translate into significantly improved quality of life for the tracheostomized and ventilator-dependent patient. The restoration of a closed respiratory system and more normal functions of speech, coughing, and swallowing facilitate faster weaning from the ventilator and decannulation of the tracheostomy tube. For the medical provider, cost savings are realized with reduced aspiration, improved secretion control, and shorter lengths of stay. Since its development, the Passy Muir valve has become a standard of care for tracheostomized and ventilator-dependent children and adults. To learn more, please visit Passy Muir's website for product information and continuing education programs, including self-study and live web-based courses. All of our courses are free and offered for continuing education credit through ASHA, AARC, and California Board of Nursing. Or call one of Passy Muir's clinical specialists today.